There are more than 140 hospitals across Oklahoma, but so many face the same problem. They're not making much money. A recent example of financial challenges is Norman Regional. The hospital system had $328 million of outstanding debt last June. And that debt led to the hospital's bond rating, or the financial snapshot of the hospital, being lowered several times since 2021. Now, Norman Regional is exploring new ways to serve the community, saying in part, quote, "To ensure the people of Norman and our region have access to hospital services, we are interested in the possibility of partnering with another compatible health system." But Norman Regional isn't alone. KOCO identified at least 47 hospitals in Oklahoma that have been operating with negative margins, and many of those are in rural parts of the state.
Rural hospitals all across this nation have continued to close over the last few decades. Here, just most recently in Oklahoma, we've had a couple closures.
Pauls Valley lost its hospital in January for the second time since 2018. While the hospital did not return our request for an interview, the Pauls Valley Democrat reported that it was monthly shortfalls into the six-figure range that led to its closure.
We don't want to have in our state is we don't want to find ourselves in a position where we lose a small hospital in one of our small towns, and that town becomes a paper town.
But data shows 60% of rural hospitals in Oklahoma are at risk of closing, and 23 facilities are at an immediate risk. This information comes from the Center for Healthcare Quality and Payment Reform. So what is causing all of this money trouble? The report says it simply costs more to deliver care to small communities. Rich Rasmussen with the Oklahoma Hospital Association says the low numbers of patients in small communities also adds to the problem.
The challenges that we have in our small communities are really financial, because we don't have a lot of patients. And so when Medicare has begun to move to Medicare Advantage, which for our smaller hospitals does not cover their cost for delivering that care, that creates financial pressure.
Saying it's managed Medicaid that has allowed these hospitals to stay open. Without it, many would be forced to close their doors.
Allow the hospital to be reimbursed at a level that is closer to what private health insurance pays. And that is done through a federal government and state government sharing a part of that cost.
But keeping hospitals afloat could come with challenges if the Congress chooses to slash Medicaid expansion.
And so in Oklahoma, as an example, this would have an impact of approximately $1.6 billion annually if Medicaid expansion, and for us that's Sooner Select, if it were not to be funded by the federal government.
And losing hospitals doesn't just impact those who are sick in the area.
But if you lose your health care, people are going to step back from that decision of whether or not they want to live in a small town if they don't have a place to deliver their baby, if they don't have a place in the event of a tractor accident, you name it.
And also this, important to note that Oklahoma hospitals represent 18% of jobs across our state. The latest info from the Hospital Association shows hospitals contributed $30 billion to Oklahoma's economy.